The way that he'd murder patients is truly disturbing. Had injected some sort of medication at too high of a dose. How was he able to do this? How was he not detected earlier? Hi guys, today we're going to be doing something a little bit different, actually a lot different. We're going to be talking about murder. This case is just completely shocking. It is just horrible, and the whole reason that I wanted to talk about this is because I was in a medical ethics lecture the other day and we were talking about medical scandals and cases of medical negligence, and it really just got me thinking about how much power healthcare professionals have and how sadly some people misuse this power. And I think as a future doctor it's really important for me to be educated on these cases. So for the last few nights I have been deeply investigating Dr. Harold Shipman, and I have learned so much about who he was and what happened, and I thought it would be really interesting to share this story with you guys. So do let me know if you enjoy this video, and if you guys do, then maybe I'll make this a regular thing. Maybe I'll discuss more medical cases, more medical crimes, more scandals, and yeah, just let me know and maybe we can make this a series. So today we're talking about Dr. Harold Shipman, who is thought to be the most prolific serial killer in modern history.
The Shipman case continues to undermine public faith in the medical profession.
His victims ranged in age from 49 to 81. Most were fit and well, none had life-threatening illnesses.
She trusted his every word, like anybody would with a GP. You have to trust somebody, and if you can't trust your doctor, who are you supposed to trust? And she trusted him with her life.
I wanted to explore how a man who was respected by his patients and admired by his community could actually have been murdering the people who he was supposed to be looking after. It's truly bizarre how this whole thing could even happen, and there's so many just strange aspects of the story. But in order to understand what happened, I think we need to start from the beginning. So Dr. Harold Shipman was born in January 1946 in a place called Nottingham, which is really spooky because I was also born in Nottingham. Everyone called him Fred because his middle name was Frederick, and he was born into a very working class family. He was the second of 4 siblings. His mother Vera wanted a better life for all of her children because being working class, it obviously wasn't the nicest. And Fred was actually her favourite because it said that he was the smartest and showed the most potential, and she really pinned a lot of her hopes on him. Because he was her favourite, it said that she was more controlling over Fred, and she kind of picked who he could play with, kind of controlled what he could and couldn't do, and was actually quite strict with Fred and her other children as well. Fred managed to get into a good grammar school at the age of 11. This was an important achievement for the family. Sending a child to grammar school was a sign of success and a sign of intelligence. Many sources paint Fred as an outsider and a loner, and reading more into his background, yes, he definitely was an outsider, but he wasn't a complete loner and freak. Fred was definitely a quiet boy and a quiet teenager. He was definitely more reserved and didn't really involve himself with other people too much. He was never super popular or part of like the in crowd, but he wasn't really a true loner. He was part of the rugby team. Apparently he was really good at rugby, and he also did cross country, and he knew people through doing those sports. He even went on a rugby trip with the rugby team, so he wasn't a loner who didn't speak to anyone, didn't know anybody, and was regarded by others as being a freak. Fred was very close to his mother, so when they found out that she had lung cancer, it was very difficult for the family. As Vera's lung cancer progressed, she would sit in her armchair and she would wait for Fred to come back home from school every day and wait to hear about how his day was, and they'd have a cup of tea together. Even now, almost 6 years after this period of Vera's life, we still don't have good survival rates for lung cancer. So back in those days, having lung cancer meant that you were almost certainly going to die. As she got sicker and sicker, the only things that would bring her some relief were Fred coming back home from school and talking with her, and then the GP coming around to give her injections of morphine to relieve her pain. This process of the doctor coming around to their house and injecting morphine is a very important step. So remember the morphine, because it is this very thing that probably shaped Fred into becoming a serial killer. Up until that point, it doesn't really seem that Fred had expressed any interest in medicine or was really working towards it at all. But after that, he decided he wanted to become a doctor. And it's unclear if this desire to become a doctor was for good reasons or bad reasons. We'll never know. But he managed to get into Leeds Medical School. Another important fact here though is that he didn't get the grades to get in the first time. And he actually had to resit exams and then went the next year. This is really important that he had to resit exams and did not get in the first time. So remember this as well. It's probably understandable why he had to resit his exams. His mother had recently died. He didn't really confide in anyone about it, and he mentioned it to a couple of friends in passing after it happened, but they didn't even know his mother was sick, and it was a shock to them. He never really had a close relationship with other people where he could comfortably discuss his feelings. This whole character was someone who really kept to themselves, was very quiet, didn't really like mixing with other people, was very apparent from his childhood and his teenage years. Again, slightly freaked out because I lived in Yorkshire for quite a long time, so, you know, Nottingham to Yorkshire, also doing medicine, kind of freaky. Am I a serial killer? I really hope not. Back in those days, Fred was actually quite handsome, and he met a girl called Primrose in his first year of medical school, and they got married, and she was pregnant in his first year of medical school. A little bit young, but I guess love is a real thing, but nothing wrong with that. Doesn't make him a serial killer. After graduating from medical school, you have to do general training before you specialise and, you know, choose a specific area that you want to work in. So he worked in a hospital in Pontefract in Yorkshire. Here he seemed to get on fine with not really any problems. He was described by a few as being an arrogant doctor. He managed to go on with fairly few problems and everything seemed fine. It was later revealed though that during his time in this hospital, when he was in his mid-20s, he was actually committing murders. Nothing close to the scale that he would later go on to, but there are several cases that have been confirmed. There's one case which is highly suspicious and highly disturbing. There was a 4-year-old girl who was in the hospital. She had cerebral palsy and also pneumonia. So Fred went to see her one day with her mother there. The mother then stepped out to get a cup of tea just for 10 minutes and asked Fred to be kind to her daughter while she went away. When she came back, just 10 minutes later, her daughter had passed away. She was extremely shocked and it didn't really seem right. It was strange that she died so quickly. It was later concluded that it's thought that Fred had injected some sort of medication at too high of a dose. He might have been experimenting, he might have intended to kill her. He might have interpreted the mother's words, "Please be kind to her," as a signal that it was okay for him to end the 4-year-old's life. Whatever the reason, it's highly suspected that he prematurely ended her life. He is thought to have been responsible for a number of deaths whilst he was working in the hospital. So his days in Pontefract Hospital were really the start of him murdering. So after working in the hospital for a few years, he then moved to a place called Todmorden, also in Yorkshire. He became a GP there, and other GPs working in the practice said that he actually had a really devoted following of patients because the patients chose which doctor they wanted to be looked after by, and he was really well liked and generally quite well respected. And it seems as though he was changing from more of an outsider and more of a quiet person to someone who's more outgoing and more involved in the community. The only sort of thing which stuck out immediately was that he had a bit of a superiority complex. He wouldn't let nurses give injections or take bloods. He was very protective over his care, and he wouldn't let other people get involved. Back in those days it was more accepted because traditionally doctors have always been more paternalistic and they sort of make more of the decisions and can be more controlling. But these days it's completely the wrong approach, and it's not the way things should be done. As a medical student, we're repeatedly taught that teamwork is so important, and it is. You have to rely on other people and share your knowledge and expertise in order to help patients. And to me, his arrogant behaviour and superiority complex is just such a red flag for what he would go on to do. But to be honest, in those days, it was not seen as something completely abnormal. There were many other people who were like this, who weren't serial killers. There's nothing to spark like major concern. As well as not letting other people help him with his work, he'd also have this tendency of calling people stupid, which seems to be a recurrent theme throughout his adult life. This is so ironic because he was never the star pupil, he was never intellectually superior to anyone else really. So it seems ironic that someone who hadn't sailed through with the top grades was calling other people stupid. It shows some sort of arrogance and maybe some sort of delusion with his own ability. His time at the GP practice paints him as someone who was more outgoing, more confident, generally quite well liked, but at the same time someone who thought they were intellectually superior, who was quite arrogant really and quite pretentious. So at this point, Fred seems like someone who on the surface is a respectable man, but underneath that has a lot of issues and is really not as great as he thinks he is. After working in the GP surgery for only around a year, it was actually discovered that he'd been stealing a drug called pethidine from the prescriptions. So pethidine is an opioid, as is morphine, the drug that his mother was given. In the medical setting, they're used mainly for pain relief, but people use them recreationally because they can create feelings of euphoria. Opioids are highly addictive though, and this is a whole issue in itself. But what had happened is he had become addicted to pethidine. When he was confronted about this by the other GPs, he apparently lost his temper and went crazy and stormed out of the office. His wife was also there and was very angry and said they'd have to force him out, and they did force him out. He was fired and also reported to the General Medical Council, who regulates the doctors. The other GPs have said that this explosion of anger was really strange to them and kind of out of character. There's just a lot of little red flags that you can only sort of see in retrospect when you have the whole picture, but at the time you might have just thought he was a slightly angry man. Anyway, he was made to do a drug rehabilitation course and he was fined a small amount. After completing the course, he managed to secure a job in a GP practice in Hyde. Hyde is a small town, the population is about 30,000. It's described as being a very tight-knit community where everyone kind of knows each other and generations of families all live near each other. So he moved to Hyde in 1977 when he was 31, and people say he seemed like a very normal guy. He was popular in the community, people knew him, he was respected, and on the surface he just seems like a caring doctor. He first joined a group practice and stayed there until 1992. In 1992 he opened his own independent practice, but had the same list of patients from before. He actually had a few thousand patients on his register, so there was a lot of people that he had access to, particularly a lot of vulnerable people, a lot of elderly people. Many of these people lived alone, and having a visit from the doctor was a highlight of their day, so this just makes the rest of the story that much more sad.
This is the first glimpse inside the practice where 5 of Dr. Shipman's victims died.
So he continued working as a GP, and no one really suspected anything until March of 1998. A GP called Dr. Reynolds from a neighbouring practice was beginning to get concerned because she was having to countersign a lot of cremation forms, specifically for elderly women, from Dr. Shipman. And her concerns were encouraged by a local undertaker who was also getting really concerned about the number of deaths that Dr. Shipman was reporting, again, particularly amongst the elderly women. So the GP reported this to the coroner, and then the coroner went to Greater Manchester Police and requested they do an investigation. So the police did a private, confidential investigation. They went through Dr. Shipman's medical records and tried to see if there was any sort of discrepancy between the notes and the cause of death, or just see if there's anything suspicious going on. This investigation by the police did not find anything, and it is now criticised as being a very poor investigation. They did not contact the GMC. If they'd seen that he had been addicted to pethidine and that the GMC had been involved in that process, then maybe they would have investigated a bit more deeply. But no, they just checked his notes and checked that they matched up to the deaths. And they did, but that's only because Dr. Shipman had gone back. After he'd murdered patients, he'd go back and edit their medical notes.
Here, Shipman used computers to change medical records of the patients he'd killed, to falsely record diseases to explain their deaths.
The way that he'd murder patients is truly disturbing. He would mainly do it in their houses, on home visits. And he targeted elderly women who usually lived alone. He would go and he'd give an injection of diamorphine. This is heroin, and again, it's an opioid. It's mainly used for pain relief. But he would give it in such high doses that it would put the patients into a coma and they would die. He did this to so many people. It's just horrendous. After murdering them, he'd then go back and alter their medical notes on the computer and say they'd had symptoms of chest pain or they hadn't been very well, to fabricate a whole story. So his whole time in Hyde from 1977 all the way up until 1998, when the neighbouring GP reported her concerns, he had been murdering people with diamorphine. It's not entirely clear how he got his supply. He may have been overprescribing for patients who were dying and needed pain relief. He'd then go to the house and collect the leftover diamorphine and then use this to kill people. So the police investigation didn't yield any results. He was still murdering people. He had been murdering people for years at that point. So in July of 1998, just a few months after the initial police investigation, he went to take blood for a study on aging. This study was later found out to not even exist. He was taking blood from this 81-year-old called Kathleen Grundy. Kathleen Grundy was a very active woman. She was involved in volunteering. She was a very involved member of the community. Her family even described her as being more fit and active than they were. So Dr. Shipman went to her house, he gave her a lethal injection of diamorphine, and she died. One of the saddest things to imagine is these elderly women thanking the doctor, being really grateful, smiling at him as he injects diamorphine. It's just horrible to picture that. It's also really disturbing that a lot of these women were found dead just sitting upright on their sofas, dressed in their best clothes, just looking very odd. It's not really common to die sat upright on your sofa. If you're having a heart attack, if you're having a stroke, you wouldn't be sat peacefully in your nice clothes just in the middle of the sofa like this. You would try to get help, you try to get a phone, you'd look a little bit disheveled. Also, the fact that a lot of these women were wearing their best clothes, seeing the doctor was a highlight of their day, they didn't really get to spend time with many people, just makes it even more tragic that he took advantage of these vulnerable people who he thought no one would care about if they died, or who he thought people would just expect to die. It's just really disturbing. But anyway, his major downfall was that he then forged the will of Kathleen Grundy and left the vast majority of her assets to him. This was another stupid thing to do, as well as him changing the records on the computer. And Kathleen Grundy's daughter, fortunately, was a lawyer. So looking at this will, she found it extremely strange. The will looked really fake. It looked forged. It just looked terrible. She didn't think her mom would have left everything to the doctor. She immediately thought something was wrong and she reported this to the police. Police then did an investigation. They also deemed the will to be forged. They then had to investigate Kathleen's body, which at this point had been buried. It is lucky that Kathleen's body had been buried and not cremated. Dr. Shipman would always encourage families of the deceased to cremate the bodies and not to carry out any post-mortem. None was needed, the death was expected. And again, it just shows how horrible this story is, because he abused that trust that people have in doctors. If he said the death was expected, then they would believe that as well, even if it seems strange to them. If he was like, no, look, here's the medical notes, she's had chest pain for months and years, then they would just accept it, because why would a doctor lie to them? But luckily, Kathleen's body was not cremated, it had been buried. So they then had to dig Kathleen's body up and they did investigations. They found diamorphine in her body. Dr. Shipman's defense to this was that she had actually been a drug addict and had been injecting herself with it.
I've given you the cause of death, fatal overdose of morphine or diamorphine. They've asked you to comment about that.
And I have commented. I've said that I had my suspicions that she was actually abusing a narcotic of some sort, or at least taking a narcotic of some sort.
This was laughable and it was obviously a lie. Another really stupid thing he did was that he wrote the will with his own typewriter. So it was really traced back to him very easily. He came up with some really bad excuse about lending it to her and then somehow getting it back, and it just didn't add up. So police knew that there was something going on. His fingerprints were on the will. Kathleen Grundy's fingerprints were not on the will at all, so they knew she wasn't involved in the process. Everything pointed towards him. There seems to be this pattern of him doing stupid things, like altering medical records on a computer, which will obviously record at what time medical records have been edited. By forging a will and leaving all of your assets to the doctor, clearly just seems off. And then also by using a typewriter, your own typewriter, to write a will. Also, using diamorphine, it stays in the body for a very long time. As a doctor, did he not know that it would be detected in the bodies? These things are so stupid that people speculate that he wanted to be discovered and he wanted people to find out what he was doing. But I will come into all of the theories later on. So in September 1998, just a few months after he had murdered Kathleen Grundy, he was finally arrested. He was charged with 15 individual counts of murder and also a count of forgery. Throughout the whole investigation, he did not cooperate. He kept saying he was innocent. During some of the interrogations, he even closed his eyes whilst he was being shown pictures of the victims and would even yawn at points. The trial began just over a year later in October of 1999, and very compelling evidence was presented. The morphine toxicity in patients' bodies was presented. A fingerprint analysis showing that his fingerprints were on the will was presented. A handwriting expert deemed that he had forged Kathleen's signature on the will. And then also a computer analyst presented evidence that Dr. Shipman had gone back and altered medical records to make the records fit in with the cause of death. So really there was no footing for him to stand on. There was so much evidence against him that his defense could not really do anything. A few months later, in January of 2000, he was found guilty by the jury for all of the counts. And he was given 15 consecutive life sentences, and the judge actually recommended that he never be released.
Shipman stared straight ahead, showing no emotion. From his wife Primrose there was a small gasp of "oh no" as she clasped the hands of her son and a family friend. The judge told Shipman that his crimes were wicked beyond belief because they involved using his medical skills to kill in cold blood.
Something which still haunts people today is that after 4 years in prison, he committed suicide. And although some people celebrated when this happened, a lot of the families of the victims were deeply upset because that meant that all of the motives, all of the reasons, the answers were disappearing. They were being taken to the grave. He'd never given a reason for doing any of this. He'd never cooperated with investigations very much. So there was no reason, there was no motive. And we're never going to find out why he did what he did. It's said that serial killers really like manipulation, they like control and power. So maybe his suicide was his last way of taking some control and removing it from other people. As he was in jail, there was an inquiry going on into what happened and several reports were released. The last report concluded that over 250 patients had been murdered by Harold Shipman, and it's speculated by some that the number could be many, many more times higher than that. And although most of his murders took place in Hyde, particularly towards his later years when he had his own independent practice, he had been murdering patients since he was a junior doctor. It's shocking that he was doing this for over 20 years. So why did Harold Shipman murder these people? There are several theories. So one is that it was something to do with his mother's death and the process of the doctor coming to the house and injecting her with morphine. It's so similar to him going to patients' houses and injecting them with diamorphine. It's such a similar process. Some psychiatrists say that he had some sort of sexual attraction to the process of ending someone's life with an injection. Maybe that was also related to his mother's death. There's definitely some psychological aspect to this. Others say that he just enjoyed the process of killing people and it wasn't necessarily a sexual thing, but more just he enjoyed it and he liked doing it. Some say that he hated older women, and there's quotes. There's some quotes out there saying that he thought elderly people were a drain on the NHS, and maybe he thought by murdering them he was getting something back. I don't know. I personally think it has to do with his mother's death, because he used diamorphine injections to murder people. It has to have some sort of link. Whatever the reason, we will never find out because he took that opportunity away from us. This case is something that all medical students are aware of. We all know about Harold Shipman. We all know about what a terrible person he was. And I think that's actually important. I think it's really important to reflect on how he got into that position. How was he able to do this? How was he not detected earlier? He was detected because of a forged will. If he hadn't forged that will, how much longer would he have gone on murdering people? We never know. He might never have been discovered. But I think the Harold Shipman case raised a lot of questions about doctors' access to strong medications, to the GMC who regulates doctors, and also just about how much power doctors have over people's lives, and the potential is for that to be misused. These are questions that I really want to investigate in future videos and future cases and scandals and crimes. So if you guys enjoyed this video, then let me know and maybe I can do some more. But yeah, thank you for watching and I'll see you in the next video. Bye.
If confidence in general practitioners is to be maintained, it's important that the appropriate authorities look to see what lessons can be learned from this case. Sadly, nothing that's happened here, nor can happen in the future, can bring about my mum and all the other victims. We hope we can now have the space and the time to remember my mum as she was. A happy, active, caring, energetic, loving person whom we miss so much.